I would consider myself a religious person before I was diagnosed with cancer. And now I consider myself a religious, spiritual person.
We're gonna rise like the phoenix, and yeah, we're gonna beat this. Too much life to live to leave this. It's got me singing. Sure, we had some bad days, can't fix them with no band-aids, but I'm breathing, feel my heart rate. It's got me singing. To a kick that cancer song. So throw up your lighters for the 12 survivors.
Before I would go to church and I would listen and I would do the many rituals that Catholics do, which I really like because I am a Virgo and I love rituals. But I don't think I had tapped into my spirituality yet. And I learned about spirituality while I was in my bathtub. I was in so much pain from radiation and from the chemotherapy process that the only time that I would feel relief was when I was in the bath. So I would take up to 1, 2, 3 hot, very hot baths a day. And one time when I was in the bath, I started praying the Our Father and the Hail Mary, which are two of my favorite prayers. And since I'm a traditional person, I like to say those prayers. So I would just repeat them. I'd say, Our Father, Hail Mary. And this one particular day, I just went into this kind of space. And I don't even know that I was aware of being in that space, but when I came out of it, I felt like it was clear space. And in that space, I was whole and I was healthy and I felt good and I felt strong and I had no pain. It was literally a euphoric experience, a transforming experience. And it was my nirvana when I was in that place, when everything was just the way it had been before. It was just a very powerful feeling. And that was me meditating. That's what happened. I transcended to this place of purity and comfort and luxury. And so I realized that that was something I needed to incorporate into healing. And so I did that every day. And now I pray everywhere. I pray at the beach. It's one of my favorite places, especially when you feel the sun. And I'll pray in the grocery store. I'll just pray anywhere. And I give thanks. And I urge people, not just going through cancer, but anybody to connect with something that is larger than yourself, a higher power. And maybe you don't believe in God per se, but believe in something other than yourself, because you need to lean on something that is so strong that will help carry you. It will help you a lot. And I just feel like prayer and meditation and just being just there, just here, and seeing yourself exactly how you want to be, and then just opening up every channel and allowing that to flow in is a wonderful healing process. So here I am, a couple years out, and now I get my children to meditate. It takes me about 10 minutes to calm them down, and then they meditate for 2 hours. I mean, for 2 minutes, which 2 hours that'd be like, wow. But the meditation for them just means that they're quiet. And I'm just like, think about your breathing, or just think about one thing. And people say it's really hard to do, but it's practice, and you get better and better and better at it. So I did that a lot over the summer, and then school started, and they asked me the other day, like, why aren't we meditating? And I was like, oh, interesting. So they are feeling the benefits, whether they know it or not. Bring some kind of spirituality into your healing process, especially when you're going through something as challenging as cancer. There are lots of things you can eat and drink to help prevent cancer and help you get through chemo, because a lot of times when you're going through treatment, foods don't always agree with you. So I want to share with you some of the things that I like to eat, and I did eat while I was going through chemo. And this is all super healthy, hydrates you, electrolytes, vitamins, minerals, protein, all of that good stuff that you want to keep putting into your body so you can get stronger and feel healthy. I'd like to introduce my children. This is Sophia Lovina.
Hello.
And this is Connor Elvis.
Hello.
And they're going to help me make this shake or this smoothie. What are we going to call it?
Spirit shake.
One of the things that we found out is that they love coconut water. And we have this one that we got at the store, but the actual coconuts that you can buy, at different stores, they are like delicious, and they like to crack them up open after and eat the meat, right?
Yeah. But the meat isn't too good, but she loves it.
Well, that's because we didn't dry it out. But if you dry it out, it tastes more like, regular coconut. So we are going to start with some coconut water. Shake it up.
Let's do this. Okay, my turn.
All right. And
let's open it.
We're going to open it. And we're going to put it in the blender. Tell me when.
When? Now.
I'm going to have right there. Okay?
Yeah, that's 500.
So, you can just drink coconut water plain. That's good too. But, some people like to use soy or almond milk. I like coconut water because it just gives you that tropical taste. You can feel like you're on vacation.
Yeah.
you get
Hawaii.
Yeah, like if you smell it, doesn't it smell like Hawaii?
Oh.
Oh, okay.
That was it?
Yep. Well, yeah, you can drink some after.
You said no.
Okay. And then blueberries, which are like super amazing food. The skins are excellent, and they just have so many qualities that will help you feel stronger. And so we're gonna put Connor, go ahead, put put a couple handfuls in. Power plant foods, that's what they call them. Power plant. Okay.
One more.
They did wash their hands, by the way. Oh no, blueberry down.
Yes.
We'll get that one. Okay. And then I'll just
Explosion!
I'll put the rest in.
It's raining blueberries.
It's raining blueberries. And then strawberries.
Woo! 2. It's like the Smurf movie, the little mushroom person.
Oh yeah, that's right. We like Smurfs.
It's raining Smurf houses. Like in Pac-Man.
Okay, but not all of them. Just a couple more.
Like in Pac-Man, when
Okay, that's good.
when the lady shot the Smurf and said, "Don't tell anyone I shot a Smurf."
Yeah, you can't shoot a Smurf. All right, so I'm gonna put the pineapple in.
Ooh, pineapple.
This is very tropically.
Tropically.
Very tropical. Tropically. It's tropically.
Chocolate.
All right. And then bananas.
Yummy. Banana.
I'm going to put all these in because the bananas make the smoothie smooth, extra smooth. And then mint. We're going to put a little bit of mint. What do I do with mint every day, guys?
Eat it. Put it in your tea.
I eat it.
I
put it in my tea.
Can I
it's
taste
so good
it,
for you. And it's a natural breath freshener.
Can I taste it?
Yeah, taste it. It's super good. So don't put the stems in, just put the leaves.
Okay.
Okay?
Thanks.
And this will just freshen it up. Because we want a fresh smoothie. Okay?
Kind of sounded like you said French.
Yeah, I did say French. That was a mistake. All right. So now we're gonna. This is Connor's favorite. What is it?
No,
Can
mango!
I do it, Mom?
Yes. Okay, cut it up. So basically what I did was I went to the store and I just got all of their favorite fruits. And that's what I'm putting in here. And you know, it's whoops. Here, Sophia, I need a knife, please. It's, if you can, I mean, it's worth it to go organic, to spend a couple extra dollars, or you know, go to the farmers market on Sunday, and you can get it there. But you know, it makes a difference, and I think that you know, if you want to be extra healthy, that going organic, and I was never like that before.
Mom, can I eat this one?
Yeah, go ahead.
Yay.
Can I eat that, please?
Have one of these.
Yay.
Yummy.
It's better for you, you know, because the food is just clean. Yeah, that's what I like to think about that. It's clean food. So go organic when you can. Okay, so what do you guys think? A little bit more mango?
Yes.
Mango,
Really
mango.
good.
Mango
Are they
smoothies
good?
are the best.
Yeah.
Mango smoothies are.
And also banana and strawberry.
Okay, wait.
These ones
Yeah.
are nice and
Oh.
sweet, Mom.
Napkin.
Okay, good. They're eating the proceeds. Good. All right. Okay, so we got our mint, and then my favorite, vitamin C. Huge antioxidant fighter.
Oranges have vitamin C.
Pretty sure that's a lemon.
I eat lemon rind. I put lemon in my tea. I do drink a lot of tea, and I'm just gonna
You're
grate.
putting the skin in
I'm
there?
just gonna grate a little bit.
Wait, why are you putting the skin in there?
Well, you're not gonna notice it. You see? You know, I could have put kale in. Actually, I forgot to get kale, so lucky for you.
Yeah, I'd rather have
So
lemon.
yeah, you think kale is yucky, but if you put it in here and it's so good for you that like you don't notice.
Can I try?
Yes.
Don't
hurt
shred your
hand,
finger off.
though. Yeah, that would not be good. Kick your fingers up.
Can I eat
Okay.
the rest of the mango, Mom?
Sure. Okay, that's good. Awesome. All right, and then our last ingredient is this. What is this?
I don't know.
Flaxseed. It's fiber. What does fiber make you do?
Make
Poop!
you. Yeah.
What does it do?
Poop!
Make you poop.
He's acting like he doesn't love to say the word
Poop!
poop. It's okay to say the word poop. We need fiber to help us poop, which cleans out our colon, which gets rid of all the toxins. And, we can't put all of this in there. And keeps our colon clean. So you have to incorporate some kind of fiber into your diet. And this is a really good way of doing it. So I'm just going to put in 1 teaspoon.
So, Mom,
That's good.
Mom,
Yes.
can you poop out cancer?
We're blending. There you go. Take your favorite fruits, coconut water, soy milk, almond milk, flax, or some kind of fiber, mix it together, and you got yourself a cancer-crushing spirit shake.
I am Sophia, and I am 9 years old. I will be 10 in 20 days.
And I am 8. And my name is Connor.
We did not know that she had cancer until last summer. She didn't want to tell us that she had cancer because I was 6 and he was 4. And cancer is just really, scary, especially because she had stage 3. So she just didn't want us to get worried. We knew about cancer, we just,
Didn't know what it was.
we
We knew the word, but we didn't know what it was.
exactly. I didn't find out, much about it, chemo and tumors until I was on a play date with my friend and her babysitter had cancer. and we were just talking about it. And we knew about it, like you know how the football players wear pink socks and like pink wristbands for cancer support. So we knew about it. We just didn't know that our mom had it or like what it was.
Where's Mom?
Yes, but she was in the hospital and I didn't like being away from her. She said that it would only be for a few days and that they were doing surgery. I didn't know anything. We were just like, oh, she's just in the hospital. And we didn't know anything. And she said 3 days, and it turned out to be like another day. It turned out to be a week, and I was really
2 weeks.
upset. Yeah, 2 weeks, and I was really upset about that. And I was mostly sad. And so her not being around that much, we were really sad about it. We went to visit her every once in a while. We would pretend we were spies because they weren't supposed to allow kids in there. But we like hid and it was like James Bond hiding on the walls like, no. And then we snuck into a room, and one time the doctor came in and she's like, kids aren't supposed to be in here. We're like, oh. So we had to say goodbye and leave. But so yeah, her not being around that much was
Not fun.
Yeah, it was sad. Well, I don't think you do, right?
Let me think. Something that, I don't know.
Because when I say tumor, you don't know what I mean, right?
Something in your body?
Yes. But I know that what cancer is like, I'm not exactly sure, but I know that when you have cancer, you have a tumor somewhere, which is like a really small bump. You can't see it, but doctors can I think see it with a
Computer.
camera. Booty cancer!
Yeah, booty.
Bum cancer. She jokes with her friends how she tries to be bright about it, and she says, because normally if you have breast cancer you get no new breasts because they have to take them off, and she said, why didn't I get a new bum?
I didn't really know what cancer was, so I was like, oh, she has cancer.
Yeah, he didn't get it when he told us, but we weren't that emotional because
We didn't know what it was.
yes, and because it was a long time from now, and she was with us now, and I was just really relieved, and I was like, wow, you had cancer and you survived, and I just realized so much, why she wasn't there, and one time for school, it was my last day of school. I think it was my first time at Berkeley Hall, and it was our last day of school. So the primary has a picnic, and it was the last day of school picnic, and she had told me that she couldn't make it, and I was really sad, and she knew it. So I was like, okay, it's just going to be with my dad and my brother. So when I got there, I saw her in her black velvet robe in a wheelchair, and I was just so happy. But she said, she was telling me how it hurt her so much that she did it because she knew how much I wanted her to be there, and I'm so grateful for her to do that for me.
Yeah.
I was actually on the computer, and I was looking through documents. I was looking for something, and I saw this thing. It said Kickingcancers, beep, and and she, I was reading it, and then I told her when she told us that she had cancer, I'm like, so what was that about? And she's like, oh, we're doing it to the tune of Bird Lies. It was Kickingcancers, we're gonna fight it. It was just, and yes, she is a total
Cancer
crusher.
We are here with Dr. Zuri Morel. How are you?
Fine. How are you today?
I'm very good, thank
Excellent.
you.
Excellent.
As you can see, he is a very important doctor. Look at all of these wow, accomplishments.
I'm the medical director for the colorectal cancer program here, but you talk about all of the awards and everything, but the ones I'm really the most proud of is really the community service, because to me, a lot of times the medical field, medical problems, and especially the disease that I deal with, can be very daunting and very embarrassing and very challenging for patients. And so I really pride myself, in addition to being what I think is a good surgeon, being able to get into the community and kind of trying to make people feel comfortable about a problem that exists that many people are embarrassed to talk about, and that's colorectal cancer.
Yeah. Unlike myself, who's not embarrassed.
Exactly. You're very rare, but you're exactly, I mean, and I don't know how this sounds, but you're what it needed. You're what somebody who is outgoing, who's not afraid to talk about their experience and to show how great the outcome is for a large number of people.
Yeah. I was lucky I got that one, because breast is pretty much covered.
Breast is covered, and we're still making new, discoveries every year. But breast now is not a dirty word, and that's the NFL players talk about, breasts.
They're wearing pink right
now, right?
That.
And colorectal cancer is actually the number 2 cancer killer, in America.
Yes.
Number 1, and it's the 3rd most common cancer, and this is of men and women.
Right.
But it's still yet to get that kind of national attention, I believe, that it deserves. And I think part of it is because of the very nature of it.
The body part.
The body part, and the word rectum. And so rectal. I always encourage everybody to say colon, say rectum, say anus. You got to get over these words. These words.
Yeah.
And as soon as we can make those words like breast.
Yeah.
And I think we'll be making serious dents in this disease.
We're going to make some dents.
Exactly.
And I mean, I've given it my own words, like booty, bootylicious,
exactly.
back end, backside,
right.
that other word, the A word.
Yes, yes.
But, back at you,
right.
I have had a lot of fun with, in the midst of the pain and agony of having colorectal cancer, been able to laugh a lot about it, because I think that's a huge part of healing.
Exactly.
Laughter.
And I think when people say colorectal cancer, they don't think of somebody like you.
No.
They think at all.
I didn't think of somebody like me.
Right. But I mean, even when you're done, even when you've been treated and everything, they don't think that they can look like you. And people are walking around and they are healthy and they have survived it and they're continuing to survive it. And it's not the reason I went into this field is because it is not a death sentence. There's a lot of cancers, unfortunately, which, while we made a lot of strides, but they are a lot of times fatal.
Right.
With this, first of all, I don't believe people ever need to get this disease, number 1. But number 2, if we catch it early, you can actually still cure people.
Absolutely.
And you can cure a majority of people if you catch it early. And that's what attracted me to this disease.
Yeah.
Which is kind of the paradox.
Saving lives.
Exactly. Yeah. Saving lives and doing something that you can actually make a dent in, which is still, it's kind of a paradox, because it's mind-blowing to me that we are still, and we being Americans, are still dying from this disease at such a high number.
Yeah, it's not necessary.
It's totally unnecessary. And so that's why this is my passion.
Yeah, you're good at it.
Oh, thank
He's
you.
got a lot of spirit. This one, not your typical surgeon. I mean, if there's a stereotype.
Right,
when I first met you, I was like, wow. I'm like, oh, that's the surgeon. I got to connect with him. Oh, that for sure. So, no, I love your passion, and I love your willingness to go out there and, you can just come here and do your job and leave, but you do so much more, and it's inspiring. It's inspiring to me.
Thank you very much. Well, you inspire patients all the time, so I think that's what's great. I mean, if I can encourage people to just talk about this at the dinner table, basically talk about what we eat, talk about and actually even getting the knowledge, right? So you need to eat fiber. Need to drink water. All of that can help decrease our risk. But the number one thing that we need to do really is get screened.
Get checked.
Check
yourself before you wreck yourself.
Exactly. And that's what we need to do.
Yeah.
And I think that people, if it's not proposed to them by their doctors, then people often don't bring it up.
Of course not.
And they need to, and you need to be your own advocate. And that's really the key, I think, with both of our passions, is making sure that you as a patient, as a person, need to really be your own health advocate. And what does that mean?
Right.
That means if something changes, so number one thing, changes in bowel habits.
Right.
If you're the kind of person that goes and has a bowel movement once a day, and all of a sudden you're going once every 3 days, that's a change of bowel movements.
Right.
That's something that needs to be brought up to your doctor.
Right.
Okay, or vice versa. If you go once every 2 days and all this, or once every 3 days, and now you're going every day, multiple times a day.
That's a
change
problem.
That's a problem. So it's the changes. If you start having abdominal pain, you know,
Yeah.
and you know, it doesn't pass after a few days, and it's getting intense and more, and you know, it causing you more and more distress.
Right.
You need to actually seek medical attention.
Right.
Now that's just one half of it.
Right.
The other half is knowing kind of what to expect. When you see your physician, there should be a plan. The plan should be, we're going to try this. If it doesn't get better, then this. If it doesn't get better than this, then we're going to evaluate. That should be the natural progression. And that is something that you as a patient should insist on.
Right.
It shouldn't be,
Yeah.
well, we tried this. Let's wait another week. Let's wait another week. Let's wait another week. You know, and because the weeks turn into months, turn into years. And like I said, the key with this whole disease is to actually getting it early.
Yeah.
And, you know, there's really only 2 tests, I like to say, in all of medicine that we do to people. We draw blood, we do CT scans, we do a ton of tests, spend a lot of money, but there's really only 2 tests that prevent cancer, right? And one is pap smear, which women have been getting since teenage years,
Right.
because you see changes on the cervix and you're able to remove any cells that have these changes before it becomes cancer.
Okay.
And number 2 is a colonoscopy. Colonoscopy, as I love to tell patients,
Yeah.
is not done to find cancer. We don't do it to find cancer. We do it to prevent cancer. If you're finding cancer, you can find it early, but we do it because you see a polyp. Colorectal cancer starts from polyps.
Okay.
Most polyps, like i.e. greater than 90%, you can actually take out at the time of colonoscopy
Right.
before it even becomes a
Right.
cancer.
Before it grows into
Before
the
it grows,
cancer.
right.
Yeah.
So that's one of the big reasons people don't get colonoscopies. A lot of times they're afraid, oh, we'll find cancer. Okay, so number 1 is most of the time you don't. Most of the time you prevent cancer.
Right.
Number 2, you find it, but you find it early and you're able to treat it. And what's even more amazing about this particular disease is that even if you find it late, so sometimes, you know, unfortunately, we find it in patients and it's in the liver and it's in the lungs,
Right.
but patients can still live a long time now with surgery,
Yeah.
chemotherapy,
Yeah.
and they live well. I mean, your experience with chemotherapy, I know chemotherapy is not easy, but was it what you thought it was going to be?
No, it was way worse.
It was way worse, okay.
And I would say that to Dr. Becker. I'm like, this is way worse than you said it was going to be.
Mm-hmm.
But once I acclimated
Mhm.
and they adjusted, you know, my cocktail,
Yeah.
and I understood what the process was and, you know, how each week was going to go, then it did get better.
Mhm.
Because like mentally I was prepared, emotionally I knew it was going to break down, and then I could deal with those side effects much more efficiently.
Right.
Than, I mean, part of it is like not knowing.
Exactly.
And being the person I am, I'm like, oh, nothing's going to happen. I'm going to have
Right.
excitement. It's going to be a problem.
Right.
And then, you know, literally 1 minute I'm up, and then I was like, boom,
Down, right?
down. I was like, oh my gosh, like this is serious. And then I got toxicity. I ended up in the hospital.
Mhm.
And that was troubling for me, because I'm like, oh my gosh, maybe I'm not accepting the chemo. Switch that whole mentality around and said, you must submit. Can you explain the stages? Okay, first of all, there's anal, rectal, colon. Is that how it goes?
Exactly.
And,
So
tell me.
So colon. So we'll start with colon. So colon and rectal tends to be kind of geared together. However, we do treat them a little bit different. So
Okay.
when I tell people, everybody thinks they're the same, but when I say colon, the number 1 job of the colon is actually to reabsorb water. Okay.
Okay.
So everybody thinks it's to make stool, to make poop.
Oh yeah.
But actually, it's the byproduct
Oh.
of what happens. So when you eat food, basically your stomach breaks it down, your small intestine absorbs what's needed, and then things get into the colon. The colon reabsorbs water, and the stool that's in the colon, things that's the waste, things that the body doesn't need, that is then excreted to the rectum. Okay, the rectum's job is to hold the stool until a advantageous time to have a bowel movement. The anus's job is to decide whether or not you're going to have a liquid bowel movement, you're going to pass gas, or you're going to actually have, liquids, regular bowel movement. Okay, so everything has
Anus
a job.
has a big job.
Anus has a job. Anus is the only, we like to say it, but the anus is the only muscle in the body. When people say, why'd you go into colorectal surgery? I say, because I'm smart. And they always say, what do you mean? I say, well, I mean, think about it. The anus is the only muscle in the body that can differentiate between liquid, solid, and gas. And it is. And
I
it is.
did not know
Exactly.
that.
And so the colon typically then presents with, so when you have a colon cancer.
See what you can learn?
See what you can learn. There's always something we can learn, right? And so the colon reabsorbs water. Colon is large, right? Literally, it's called the large intestine because it's actually large.
Yeah.
And it's about 5 feet.
It's
and
long.
it can grow, and so why is that important? The problem is that if you have something in the colon, when it's small, it's hard to diagnose it. Like you wouldn't know necessarily.
Okay.
When you start actually having symptoms like
Yeah.
abdominal pain and things like that, then it's usually really large, or it could even metastasize. That's why we do the screening. That's why colonoscopies are done. Now you have to remember with screening tests, everything costs money. And it's not how much money the doctor charges, it's the money in the system. Okay.
Yes.
And so screening is meant to test the largest number of people for the cheapest price, right? You have to remember that. And so
Okay.
that's why guidelines are what they are. Guidelines are 50 because they don't think there's even enough people to do colonoscopies for, if everybody actually got what they needed, they meaning that the societies, there may not be enough physicians to actually do all of that. That's why, which is, and most of the time if you're 40, you don't get cancer, right? So the whole issue is you have to remember that percentages are fine. If I tell you that I have a surgery that's going to fix you, except if you're in that 1%, it'll fix you 99% of the time. If it doesn't fix you, it's 100% to you.
Right.
You understand what I'm saying? So,
Yes,
so
yes.
guidelines, you can fight guidelines. Meaning
Right.
that if you have changes, you need to go ahead and push for a colonoscopy.
Right.
That being said, so anyway, the colon, the most common symptom of colon cancer, not rectum, but colon cancer is actually like diffuse abdominal pain, non-specific. Things that aren't getting better and changing bowel habits. Okay? Now the rectum, I just said that the rectum's job is to hold the stool. Okay. And so the rectum is lower down.
Okay.
The most common symptom of rectal cancer is actually bleeding.
Right.
Okay. And often it's painless bleeding, which is also the most common symptom of internal hemorrhage. So, you make it a livable disease, meaning that every once in a while, and that's really the goal. It's interesting. There was a Chris Rock joke a long time ago talking about we got to the point now with AIDS where it's like, he hopes to get to the point with HIV and AIDS that, hey buddy, why weren't you at work today or yesterday? Oh man, my AIDS was acting up. I took some Robitussin and now I'm all better, right?
Right.
That's what we kind of do with stage 4, and that's my goal is that, hey, why were you at work? Every once in a while, because once it's theoretically in the lung and the liver, we haven't been able to pinpoint how to kill every single cancer cell without doing damage, right, to everything else. So every once in a while, cancer may pop up, and you treat it. You chemo, surgery goes back, goes away, and you make it a livable disease. Okay. And so usually, that's what I tell my stage 4 patients. I say, look, we're getting to the point now where you can still live a long time, but you're going to go through phases where everything will be gone and you'll be very happy. And the first time it comes back, because it probably will come back, but it won't kill you. That's the key.
Right.
And so I'm very honest with them. Stage 3, we still cure it. We can still cure you, and that's the issue. And worst case scenario, especially somebody who's gone through stage 3, is that you're getting so many screenings, so many tests, that if it does pop back, it'll be very early and you just knock it out.
You're on it. And also I did 12 rounds of chemo, right?
Yeah.
I think total.
And that's also because of your age. You're so young that they gave you a little extra.
Yeah, I didn't want to leave. I'm like, can I come in once a week just for a little pick me up?
Yeah, right.
No. But I'm like, okay, some people that I know didn't do that. And I'm like, why wouldn't you? And they're like, because it's too much. I'm like, it's like doubling down. Like, you're in Vegas. You're like, maybe that's enough, but I want all of it. I want to make sure.
Right. Well, then the toxicity of the chemo, you have to look at it that way also in terms of, we don't want to do anything that can cause, permanent damage and all that. But it depends. I mean, it's different. We're getting really good now with molecular markers now.
Right.
And so molecular markers can portend whether maybe this chemo is going to work for you. Maybe you do need a little bit more. Maybe you need a little bit less. So that's kind of like the future right now, to try to kind of decide what is best. But then I also tell some patients, some patients, they're not, the chemo affects them in such a way where, they can only do, they give it their all, and they try to, and they can only do 4 or 6. And so, and that's, I try to give them the pep talk, but if not, I try to let them know, at least you did that. You know what I mean? So.
Yeah, feel comfortable.
I always say that, once again, you guys, you should not die from fear. You should not die from embarrassment. Get this test. Get your colonoscopy. Be in tune with your body. It's very important. It's very important. And like I said, it's done to prevent cancer. And please, once you get it and you realize how easy it is, talk to people about it. Mm-hmm. Ask them if they got your colonoscopy. If you don't want to ask a stranger, that's okay. Ask a family member. But this should be something that is discussed at the dinner table with family.
This is my very new friend, Forrest. In fact, I've never even met him. So
Nice to meet you.
Nice to meet you. So Forrest is going to tell us his story. I can't wait to hear.
Well, I don't know how unique it is, but I guess I started having problems noticing blood in my stool. So that was about a year and a half ago. So I altered my diet, thinking probably it was some kind of colitis or possibly ulcers or something.
We love to do that self-diagnose,
Yeah,
right?
right,
I
right.
did that too.
Yeah,
Oh, it's
yeah.
IBS, no big deal.
No, I didn't. I wasn't sure it wasn't a big deal, but that was my first guess.
Okay.
And so I altered my diet, and I've always been a vegetarian anyway.
Really?
Yeah.
By choice?
By
or,
choice.
I mean, because of the animals or just because
Yeah,
you...
because of it's more of a moral thing rather
I like
than
that.
yeah. So I wasn't quite looking toward any problem cancer related because I figured the odds were less. But it's in my family. My mother had colorectal cancer, same thing I had.
Okay.
So, but my first guess was some kind of a problem with the colon colitis, inflammation, blood, and so I altered my diet to more bland kinds of food, and it worked for a while.
Okay.
Yeah, I couldn't notice blood in my stool for maybe 6 months, that long.
Wow.
Yeah.
That's a significant amount of time
Yeah.
to be gone.
Yeah, where I could have had treatment or been diagnosed earlier.
Yeah.
But anyway, so then finally when I saw it again, I said, well, there's not too much more I can do in my diet. I think I'm gonna, try a proctologist. Well, I was traveling, and so that I didn't do that. I put that off for a few months, and then I had a colonoscopy, and they didn't have to look very far.
Okay.
The colonoscopy runs all the way up, but it was within the first 6 to 8 inches. So
Okay.
so he said, yes, it looks like it's cancerous. It's a pretty big polyp, and we won't know, for a couple of days. We'll send it to the lab and we'll let you know ASAP. So I think the next day,
Wow.
they told me that yes, it was cancerous, and he said, but he told me the day before, even if it wasn't cancerous, that I recommend you have it removed.
Of course,
Because
it could
the size of it, he said, was not good.
What size was it? What
well,
stage were you?
No, I was stage 1.
Oh, okay.
But yeah, and it was very small. The cancer part.
Okay.
But the actual polyp was like it went all the way around the colon, and it was called a flat polyp. So you couldn't really see it. I had my first colonoscopy like 5 years before, and they
Okay.
didn't see anything.
Okay.
So
It was hiding.
yeah, and so it was probably there. You're right. It probably was hiding in the small stages. And so anyway, they diagnosed it as cancer, and so we discussed the treatment, and so they decided, I guess, one of the more modern protocol. My mother just had it excised just by operation only.
Yeah.
And just with that, and then it was over, and that was over and done, and then she lived another 35 years after that, and she died of something other than cancer.
Okay.
Yeah.
Okay. So you're doing fairly well. You're doing great.
Yeah. I mean, as far as I can tell, when I'm done, I mean, I talked to the other fellow today that had various things similar that I did, but what I found out from talking to a lot of people is that everybody's different.
Absolutely.
And even though you might be very strong to start with and less frail and all that, things are different. And so his symptoms coming out of surgery, he has a lot of problems with his stomach and different things. But he doesn't have any kind of problems with his intestines. Where my problems are related to the area of the operation and bowel movements and frequencies and diarrhea and constipation, all those. He doesn't have
all the glamorous topics that go along with colorectal.
So, but he didn't have very few of those problems. He said, but his problems, he's got to be more careful about the kinds of foods he eats and with his stomach and things like that, and gas and things like that. So his problems are very different, but yet we started out with almost the identical cancer as far as the diagnosis. And of course, mine was diagnosed, they call it a stage 1, 2. The 2 part was because of the size of the polyp, and 1 because it was only the size of a pea to start with.
This is Robert, and Robert is going to share his cancer story with us. Tell me what kind of cancer you have.
I have an anal cancer.
Okay.
Came here to doctors here 2 years ago. Not only with that, coming to his office, I have HIV with blood clots from the left leg, from the ankle all the way up to my navel, that justifies all through the veins and everything with that. So dealing with that, fighting through all this, I'm still maintaining.
Wow. Wow. Wow, that's a lot. That's a lot to deal with.
Yeah. And got married.
Yeah, well, congratulations. That's a good thing.
Yeah.
So, what stage of anal cancer do you have?
4.
Okay. And what are you doing for it?
I'm getting treatment. First I did radiation and chemo.
Oral?
No, I did
infusion? Okay.
infusions. And then after that, I did all the radiation I could do. So now I'm just on chemo. And not only there, I had a lymph node that's in my pelvis, in the pelvis area where it presses against the main artery in my left leg. And that's what causes the blood clots where it's not flowing like it should
Okay.
to my left leg.
And how many more treatments do you have left?
Right now, I had my last treatment last week. I'm waiting to do another PET scan. Getting it scheduled now so I can see where we go from there, where it stands at.
So how is your how are you emotionally? Because you
I'm
have
right.
HIV and you have cancer
Yes,
and you have blood clots.
yes.
You look so healthy.
I'm great.
You look really healthy. It's shocking to me.
Yeah, I lost some weight during the last couple of months, but some weight I needed to lose anyway. But
That's a bonus.
so yeah, that was a bonus for that. But I keep myself going, family, stuff like that, and don't let it stop. You got to think that it's something that you got. Don't let it take control of you. You take control of it, and just keep going, keep living.
And you're a man of God, I see.
Yes.
Does that help?
Yes, most definitely.
Have you had any like spiritual experiences or?
I have I'm in a lot of prayer
Yeah.
services with my godmoms and stuff that they pray
Pray on you,
pray
lay
over
hands,
me and
yeah.
like put hands on me, and a lot of spiritual that's in my family period. But I guess another thing that I have advantage of because mainly mostly in my family, we all in the field, the nursing field.
Okay. Are you a nurse?
Yes, I am.
You're a nurse?
Yes. So, and
How perfect. I mean, it's like, that can be helpful
yeah,
with what you're going through. Are you a good patient to the nurse side of you?
yeah.
Do you listen to the nurse part of you?
When I started trying to listen now.
You're trying to listen now?
I'm to a point that I'm so used to helping out people and not
Yeah.
doing the opposite direction.
Is that hard?
It was very hard.
It's hard for me too. To
Very
sit
hard.
down.
Very, very hard. Because I'm always was the one taking care of everybody. And now it came on the shoe. It was really hard to get that change there.
So how did you do that?
Just by listening to my sisters and family, like, stop being hard-headed, let us take care of you,
Yeah. Yeah.
and stuff like that. So we made out our schedule,
Good.
like where I wouldn't feel bad and hinder, like I'm working on nobody, just one person all the time. So they rotate days, and I'm fine with that.
Wow.
So it's like I'm spending one day quality time with that one person, the next day a different person.
Oh my
so
gosh.
it works out.
It's like social hours 7 days a week.
Right.
Oh,
with
I
a
like
different
that.
individual. every week, every day of the week. So I give them that time, just our time together.
That's great. That's
So,
amazing.
But my daughter get mad sometimes because she's like, I don't need nobody. I can just take care of you myself.
Oh, she wants you all to
That's it.
herself.
Yeah.
And your partner?
Yeah. In
How is-
Georgia.
He lives in Georgia?
Mm-hmm.
Okay. And how's he deal with this?
Fine.
Well, he's in
Fine.
Georgia.
Yes. Oh well, and he's going through his own. He do dialysis 3 times a week.
Dialysis.
Mm-hmm. I just got to finish taking care of him 2 years ago, because he was like on his deathbed, but I brought him back.
Really?
Yeah. But he's back at work. They couldn't believe it. He did 380. That he came back at work and everything.
Really? Wow.
They couldn't believe it out there when he came back.
It's a miracle?
Yeah.
You believe in miracles?
Yes, I do. I believe in God. That's my miracle, God.
I have lung cancer, non-small cell lung cancer.
So what's the first question people ask you when you find out, or you tell them you have lung cancer?
Did you smoke a lot? So I actually didn't smoke. It's a different kind of not smoke.
Okay, and how did you realize that you had it?
So I got sick, and at first I thought I have some kind of virus or flu. I didn't feel good, and I told my doctor 2 weeks already, and I'm still bad. And so she recommended to do X-ray,
Right?
and X-ray showed a little bit tumor on my lung, right lung, and so then they did biopsy, and so I knew this. I had a cancer, so it's very good.
Very.
I was very upset, I was kind of shocked. It was some kind of nightmare for me,
Oh, yeah.
and for my family also.
What
So I
stage?
didn't even see. I don't know about stage.
Oh,
but
they don't
I think
stage
it's 2 or 3.
Okay.
So it's the doctor never told me that, but I think it was because I had metastasis on my lymph nodes,
Okay.
and they found some spot on my brain, but it wasn't so big.
Okay, that's good.
Yeah, and basically I had the metastasis on my lymph nodes, so
Okay.
it went to my lymph nodes. And because of this, I couldn't do surgery. So I just started doing chemo.
I would like you all to meet my new colorectal friend. Is that an introduction?
That's a great introduction.
This is Hulan. And we met through my friend who called me and said, hey, I have a friend who just got diagnosed. I'm like, what's his number? And so I called him. And Hulan is actually the perfect patient because he is positive and accepting and willing, and you've weathered the whole process very well. So tell me about, let's start at the beginning. When you
Right.
first heard, tell me what that felt like, because I always like to hear everybody's rendition of
Right.
that.
Shocked,
Yeah.
devastated.
Did you have symptoms?
Yes, I had rectal bleeding,
Yeah.
but being 40 years old, going to doctors.
Yeah.
I got they told me you have hemorrhoids, and
Yeah.
I went to another hemorrhoids, and finally, one of my good friends and doctors, Dr. Ted Siamak-Taviv, recommended we do a colonoscopy and endoscopy, and that's how we found out.
So was that you that was pushing, saying because this is really valuable information
yes.
right here. This can save people's lives. What was it that you went, oh, this is just not a hemorrhoid. This is something more, or could be something
The
more.
bleeding continued, so I figured it can't be hemorrhoids because if you get treatment for hemorrhoids, the bleeding should stop.
Right.
So it took me about 4 months from the first step when I started bleeding to I went through 3 different doctors.
Wow.
And finally, he was the only one, Dr. Tabith was the only one who recommended
Wow.
the colonoscopy endoscopy.
Yeah.
And thank God for him.
Wow.
That's the only way we found out.
Wow.
Yeah. So,
That is huge.
long process until we finally.
This is
So-
this is a perfect example of being an advocate for your own health.
Right.
Because so
Right.
many people just go, oh, okay, and then they go
They
on.
let
And
it go.
meanwhile, the tumor's growing and like going from stage 1 to 2 to 3 to 4, and
Right.
yeah,
So when we found out, I was at stage 2.
yeah.
So we're still fortunate.
You still, that's
Yeah,
still
it's
fairly,
still-
and you
yeah.
stayed there. You didn't
And we
like,
stayed there.
yeah,
We-
no
yeah,
lymph nodes.
No lymph
Yeah.
nodes. No.
Yeah.
So,
That's good.
but I think when you find out, you need to go to people like Allyson or people like who know about this disease, and I think that, and you gotta surround yourself, and you gotta be positive, and
He's very positive.
you gotta be positive.
You are not difficult.
And when you
to
have
the
kids,
jar.
and yeah.
You're like, okay. How you doing? I'm good. You're like, I'm so sick, but I'm good.
I was ready to run. I mean, right away, I went into action.
Yeah.
I found out on Tuesday.
Mm-hmm.
Within a week, I started chemo, radiation.
Yes.
I got my port set up.
Yeah. I know.
I was
lickety
like,
split.
I'm gonna go. I can't stop. I gotta take care of this right away.
You went for it.
Yeah. Yeah. You know.
I like how he rolls.
Yeah.
That's how you do it. So you felt shock. What, like, was there terror and fear?
Okay, I'll tell you.
Share.
My
please.
biggest fear was
I know.
my kids and my wife and my parents.
Yeah.
That was, I didn't want them to go through, and I'm like, there's no way I'm gonna let my parents see me. You know, I was like, it just cannot happen. I'm gonna beat this. So it was 5 days of hell. I mean, every night, obviously, you go through emotions, crying.
Yeah.
But then at the end of the day, I guess it took 1 week. And when I started chemo and radiation on that Tuesday, then I said, you know what? Okay, this is it. Now we got to get down. We got to fight. And we fought. And I had great friends, great support. I mean, my friends were awesome. They didn't leave me alone the first week. They were over at my house, everyone, my family, my sister. So
That's
the support
awesome.
system was amazing. I had a great support system. I'm very fortunate.
You are very fortunate.
Yeah.
But ultimately, I think it's your attitude. You and I were exactly the same. Okay, we've got this. Like, let's get it out. What do we need to do? Like, let's get this done.
Yeah.
And so how has chemo been? Like, start from the beginning.
Okay.
Yeah.
So the first 7 weeks that I started chemo, it was very light because I was doing it in conjunction with radiation.
Okay.
But
that was the pill?
That wasn't a pill.
It was infusion?
It was infusion.
Okay.
Through port. So I felt it was pretty easy. I thought it would be much worse, but a little nausea.
Right.
The radiation did not bother me at all. I actually enjoyed going there every morning. They were really fantastic.
Can you just
because
again?
I knew that, you know why? Because I said to myself, we're going through we're going through radiation. It's getting my tumor out.
Exactly.
So you gotta just take the process in.
Yes.
And go with it. Enjoy it.
And
of course it's not enjoy, but you gotta just be positive and go with it.
This is what I'm preaching.
And
this
so
is perfect.
You
had fun with the people.
And honestly, I was sad when the radiation was over. I'm like, 7 weeks, the radiation's over.
Like,
I gave
what?
everyone a hug. I'm like, that's it? And then the chemo was over, and then we waited. So the process was, you do radiation, you do for colorectal, 7 weeks. We waited 6 weeks, and then on to the operation.
Okay, so how was the operation?
The
Resection,
operation,
right?
Yeah, resection. Okay. It was 6-hour surgery.
How long?
I came out the first maybe 48 hours was very hard.
Yeah.
Was tough. Was drowsy. The toughest part about the surgery was I had to get an ileostomy back. So that part of it was kind of hard, dealing with, that function. It was maybe 2 months of ileostomy back. That was very difficult. And then the reversal. I remember the reversal was on April 19th.
Yeah, I remember.
And I was looking forward to that day so much.
Yeah.
And that when I did that surgery, and then again you become like a baby because once they take the ileostomy bag out, then it takes time for you to function.
Yeah. Absolutely.
But it went well. I mean, everything, now that I look back, it was very smooth.
So
And-
let me ask you
Sure.
about the bag. Was it like was it difficult just like maintaining, or was it like an emotional like for me, like it was like I didn't feel sexy anymore. I just didn't.
You don't feel sexy. No.
But I've learned since then that people that have to live with that I've seen pictures posted,
Yeah.
the whole thing on Facebook, and they are sexy. You are sexy.
You are.
And it's a mentality, but for me, I had to but I was grateful, that I had the option of this, because
Right.
for me, it would have been so much more painful. But I'm just interested, what were you thinking?
For me, it was I have 3 little kids.
Yes.
So it's difficult
Angels.
being home
Yeah.
and just trying to hide and not letting them see
Yes.
this bag. Just getting used to it. But by the 8th, it was 8 weeks I had the ileostomy bag. By like the 6th week, I was used. I actually did get used to it.
You had it down?
I had it down.
See, you
get it
learn
down.
to live
Yeah,
with what
you
you have
live
to
with
live
it.
with.
If
Yeah.
I had to go longer, I would have been
Yeah.
fine. I
Yeah.
mean, it was my wife was a big help,
Yeah?
because I couldn't, when the bag got stuck or
She helped you with
She
it?
helped me a lot with it.
Okay, good.
So having a partner and getting help is very important
Yeah.
through
Yes.
battling when you're battling cancer. I
Absolutely.
think that's the most
A
important.
positive part.
Positive
Yeah.
partner, and so we got through it.
Good.
And then after the reversal was, you wait another 2 months and post-op chemo, where I am right now.
Right. And how many rounds are you doing?
This is my 7th round today. This process was a lot more difficult than first round chemo. I think it's so cool.
Yeah.
Oncologist Dr. Nasir, my GI Dr. Tabib, they were all fantastic.
Good. Yeah. That's
Yeah.
That's the key, to surround yourself.
Right.
And you have such a wonderful support system, and I mean even your own, like the decisions that you make in your own mind have gotten you so far. And I know it wasn't easy. I know it wasn't. But you champion yourself and others by your thought process and how you look at it. It just makes all the difference. I know you've talked to other patients that may not have like the same, point of view, or they're down, and I'm sure you try to pep them up, and
Right.
it is a mindset.
One thing that also helped me is writing a journal.
Yeah, okay, good.
So, to go back, I have a second cousin who went through childhood leukemia.
Yeah.
So he came and talked to me the first few days also, and he said, write everything down.
Yeah.
And I think that helped
Yeah.
me also.
Good.
Just writing a journal
Yeah, just
about my whole
processing.
experience. That was very helpful also.
Good.
Processing it and writing it down,
Mm-hmm.
and one day you could go back and maybe your kids, or just help people. I mean, I feel like, unfortunately, people don't go for checkups. They don't, colonoscopy, doctors will tell you, oh no, you won't need it till you're 50, even if you have symptoms. And that's what I heard over and over. No, you don't need it till you're 50.
Neither of us are 50.
And neither of us are 50.
Yeah.
And maybe like 10, a lot of people that I talk to that went through colorectal cancer are all 40 or under 40.
Yeah, I know.
So now I'm like, we need to change that.
We are. We're gonna
Yeah.
change it. We're working on it. That's why we're
So,
doing this.
right.
Like, it's completely preventable.
Yeah. It is preventable. Cancer is something that, as long as it's addressed early, there's
Taken
cure.
care of.
Taken care of.
Absolutely.
There's cure.
Yeah, it's not like the old days.
No. Allyson, I want to thank you also.
Oh.
You've been an inspiration for me. You've helped me out through this process, and I wish there's a lot more people like you. Because when we go through cancer, we need people like you to keep us going. And I hope to follow in your footsteps
Oh, yeah.
and help other people.
You're one of
just
us.
like you've helped me. Thank you very much.
I am very excited to be here with Dr. Nasir. He was not one of my doctors, but I've heard his name for several years, and I know that he's an excellent doctor. And Hulan, who you saw, told me that he was being treated by Dr. Nasir. So I came here to see Hulan, and I'm like, is he in? And they said, yeah, but he's really busy. And so I had to like devise a plan to like get him in the hallway. So I scooped him. I'm like, Dr. Nasir. So first of all, thank you very much for doing this.
My pleasure.
For inviting us
Thank
in.
you for being here.
And I know that you're a good doctor, but you go above and beyond, and your patients talk about it. You can read about it, and I just know it from my interaction with you. So let's start with the basic questions, which are, what is an oncologist?
An oncologist is a physician that has specialized in treating cancers. It's usually cancer treatment as well as blood treatment. So we do hematology and oncology. You first go through medical school, then you go through 3 years of training to become an internist, and after becoming an internist, you do another 3 years of subspecialty and fellowship to specialize in treating cancers. So that's an oncologist.
That's a lot of school. And then when did you decide to set up the Cancer Care Institute?
You know, I was not even going to be a cancer doctor.
Okay.
When I started medical school, I was more interested in becoming a neurosurgeon.
Oh,
So
wow.
I started doing research and worked with the right guys to get myself into a neurosurgery program. And then all of a sudden, my father was diagnosed with stage 4 prostate cancer. And he got really sick very quickly, and I basically got a quick crash course in oncology through my dad's experience.
Okay.
And within the first few months of going through what he was going through, sitting on the other side of the table than doctors and seeing what the oncologists do, I decided I should really become an oncologist.
Wow.
So one of the goals I always had as an oncologist was to be able to treat any type of a patient that I want to treat. I didn't want to be dictated in terms of what to do and what not to do and limit myself to a certain type of cancer. So to be able to do that, I had to have my own practice. I had to do it in a sort of a private, individual way that I can call in the shots. So when I finished my fellowship at Norris Cancer Center at USC,
Right.
I decided I'm not going to work for anybody. I'm just going to go straight into private practice. And so since 2002, I've been an independent private oncologist. They call me a dying dinosaur because we don't exist anymore. Everybody's becoming bigger groups. Offices are not as they're not family type of offices anymore. We go see an oncologist, they're a group of 10.
Right.
If you
Right.
If you need to call your doctor on Saturday night, you may never reach your doctor. So I'm trying to sort of
Wow.
keep that old-fashioned model in combination with all the high-tech stuff we do as oncologists in one roof.
So your patients have access to you at all times.
Pretty much. I haven't had too much in terms of vacations, but even when I go on vacations, my patients always have access to me directly. Majority of my patients have my personal cell phone. And it's not easy, but they understand that I work hard. They don't bother me, but if they really need me, they come to me direct. They don't have to go through a nurse practitioner or some coverage person who really doesn't know them.
That is wonderful. I know, having been a patient myself, to have access to your doctor or to your surgeon is just a weight off your mind. Like if you're worried about something or you're in pain and you can talk directly to your doctor, it's like makes a world of difference.
One of the when a patient is diagnosed with cancer, obviously people think of it, the first thing is a death sentence.
I know, but we're
And
changing that.
We're changing that. But then, other than the cancer and dying and all that stuff, is the anxiety about what's going to happen when I'm on chemo, and questions come up.
Yes.
I always tell my patients the first few times when you go through chemo, the littlest thing that's wrong or there's questions in mind, just call me. Don't be afraid. Once you go through this for a period of time, you realize that it's not as bad as it used to be.
Right.
With all the tertiary supportive cares we're doing for patients in terms of nausea medications, we do cold caps to avoid hair loss, hydration therapy, pain medications, antibiotics. We have the experience of going through chemo is not as bad as it used to be. I mean, still, I don't wish it on anybody.
No.
But, going through newer drugs we have now with targeted therapy, anti-angiogenic therapies that are not as toxic.
Right.
It's the experience of being a cancer patient is not like when my father had his cancer 20 years ago. It clearly has changed.
And that's a really good point when you're talking about, being in pain. Doctors now will try different things. If one thing isn't working, like one pain medication, they will try different ones until you don't have to be in pain. You find a way to break through.
Again, I don't like to put everything into a very personal situation, but when my father had his cancer, he had cancer in all over his bones. He had it in his spine and in his hip, and I did see him suffer on a daily basis. And really, the supportive care wasn't there. Now, today, as an oncologist, I feel like more than 50% of what I do is supportive care.
Right.
Listen, if a patient has stage 4 disease, yes, you want to make him live a longer life, and they are living longer lives, but that length of time should be with good quality.
Right.
And it's not just the quantity of how long we live, it's the quality.
Absolutely.
And being able to be there and go to your kids' baseball game or be able to go to a movie with your wife and not sit home and suffer.
Right.
So, and again, there's been an explosion of new drugs in terms of pain medications. We have sprays under the tongue, we have dissolvable tablets, we have liquids, we have nerve blocks, we got radiation, we got all sorts of fancy stuff just to focus on the pain. And pain is just one aspect of oncology that requires supportive care. There's a ton of other things. Nausea. Imagine every time you're trying to eat, you just can't eat. Neuropathy, dehydration, all sorts of stuff. The other aspect of symptom management is introduction of medications like Marinol, which is medicinal marijuana.
Right.
That some patients that we can prescribe through the pharmacy, and they can go get it as a pill. They can get medications. There's more research being done in terms of use of marijuana oil. Those are the areas that I think we need to focus more on in terms of how we can make the life of a cancer patient better, not worrying about addiction. I don't worry about addiction when it comes to my patients' pain anymore as cancer patients. And I don't think they'll ever become real street addicts. They might become dependent on pain meds, but they don't become full-fledged addicts because they really are suffering. They need the medication. Just like they have nausea and they need nausea medication, they have pain, they need pain medication.
Yes, after my first surgery, I found Dr. Sack, he was my surgeon, and I was in so much pain, and he's like, "Are you taking the pain medication?" I said, "Well, I'm not taking, I think it was every 4 hours, every 3 hours." I'm like, "Well, no." I go, "I don't want to get addicted." He's like, "Take the pain, take it. Like, stay on top of it. Like, don't chase the pain. Like, manage it, stay on top of it." And I did it. I'm not an addict. So
you won't be an addict.
No.
And again, a lot of times when we have younger patients, people who are 18 or 19, and the families are worried about, oh my God, my son is taking a pain medication, what's going to be with him when he's done with his chemo. There's a lot of reassurance that as long as it's done properly, under proper supervision, those issues are no issues. And people should not suffer. It's not fun to sit there and be in pain 24/7.
No, of course not. One of your patients mentioned that something about his healthcare plan and that if it didn't work out, that you would work it out with him. So apparently, you're making it possible for all patients to be treated.
You know,
I don't want to
no.
have your door be knocked down.
Let me tell you something.
Okay.
One of the things that I'm genuinely, few things that I'm proud of is that we never say no to anybody. I never forget an illegal immigrant, 32-year-old with 3 kids who came to me with stage 4 stomach cancer. And he had gone to a county facility, and he was seen and he was placed on hospice care, was sent home within less than 2 weeks on a morphine drip. And somehow they heard of me because I treat a lot of terminally ill sick patients. And they called my office, we brought him in. He actually was brought in here with a stretcher. He couldn't walk. 32-year-old guy with 3 little kids. I looked at him, he had no insurance. And I told my staff, we're going to put him down and we're going to start chemo today. He lived for almost 2 years.
Wow.
And we took him off hospice care. We were able to get him emergency Medical. He was treated, he enjoyed his kids. And he went on for those 2 years. I have a young lady, which I hope one day you'll meet. She was in her mid-30s. The daughter of one of my patients with no insurance came to me with right eye blindness. And she was told she had retinal detachment. You don't get retinal detachment at age 35.
Okay.
So we got her admitted with no insurance to Cedars. We did an MRI of the brain. She had a big tumor behind the orbit. And we staged her fully, and she had a large lung cancer. This goes back 8 years ago. She had lung cancer with brain metastasis. Today, she's still alive as of October 5th, 2015. She made one wish to me. She said, Dr. Nasir, at the time, said, you know what, I have a 9-year-old son and a 7-year-old son. All I want from you is to make my 9-year-old be able to take care of my younger one before I die. Well, today the 9-year-old is 17 and the other one is 8 years older, and the older one is taking care of the younger one. And what was ironic, she came to me about 3 months ago, being on 8th-line chemotherapy for lung cancer. It's just like unheard of. Usually these people should be dying within 6 to 12 months. She looked at me and said, you know what, mission is accomplished. My older son is 17. They don't need me anymore. I don't want any more treatment. So it just happened, as she told me that, we just got an approval for a new drug called Opdivo, which is an immunotherapy. She had not seen. She had seen every single drug in the book. And we started on this drug about 3 months ago, and she's still kicking, and she's still alive. And the reason I'm bringing all this up, if it wasn't because of my staff or an office like this, who took the initiative to take care of an uninsured patient, this woman would not be here 8 years later, and the kids would not have their mother. So that's something, we're proud. It's becoming more and more difficult. The prices of chemotherapies are astronomical. The pressures are heavy, especially as a solo practitioner. We don't have donors or big companies supporting an office like this. So we've got to be really careful. But we do what we can do. And the bottom line is what goes around comes around. I work close to about 18 to 20 hours a day. I was at Cedars last night, this morning, till about 4:30 in the morning. And that's how I'm able to manage in an office that we do treat highest of the highest VIPs. At the same time, we've not given up taking care of the indigent, homeless, mentally retarded, disabled, old folks that have nobody to bring them into this office. Occasionally, I brought into my office by my other patients. We have people in this office that nobody cooks for them. My main nurse cooks for them soups and brings them in and they take it home. I have more blessed patients who are VIPs and hear about a patient not having money to eat. They send them fresh food to their homes. This all happens in this little office.
That's the spirit of cancer right there. That's exactly what we're talking about. It's, wow, it's so beautiful. It makes me feel so emotional because I have children too. So to hear that mother say that is like, wow. And you made that happen for her. I think that any parent that gets diagnosed, that's what they want, is to be with their children. And so for you to do that, for somebody that doesn't have medical insurance, that's a lot.
And we're blessed to be in a country where even if you're not insured, there are always
there's
ways
options
to get help. I mean, there's programs for young women with breast and cervical cancers that automatically they can get insurance. Right now, there's no issues with pre-existing situations as long as people can afford some sort of insurance. And if they can't, we can push some buttons through social workers in the city to get them some sort of coverage.
I know that you won the award, Random Acts of Kindness or Acts of Loving Kindness Award. What can you tell us a little bit about that award?
Well, it basically was an award that was given to me because of treating people who were not fortunate like everybody else. And this sort of echoed within the community, and I was approached that, I'm a candidate for that. It's not, I get my award other ways. I get my award from a lady she's here 8 years out.
Right.
There is no award than her telling me, listen, my kid is now 17 years old. You saved one patient like that, that's as big as of an award as you can get. For me, that award was mostly to me, it was a gesture to other people that we should all care as doctors. What I'm doing is not really going beyond and above. That's something that should be expected of anybody. This is what we should do, and believe it or not, treating people who are less fortunate always brings more strength to me and my staff. Mm-hmm. And at the end of the day, things work out better.
I believe in miracles, and I am quite sure that you do too. You probably have some miracle stories I would love for you to share with us.
Listen, every day in this office we see miracles. Sometimes it's really mind-boggling. Things that you as a doctor don't believe happens. Like a young guy in his 40s who comes into the hospital in septic shock, blood counts down to nothing, with cord compression and paralysis, with pneumonia, intubated on a machine, diagnosed with multiple myeloma at that young age.
Oh my gosh.
And I ended up, against all odds, treating him on heavy-duty chemotherapy, on dialysis, ventilated, over 6 years ago. And this man is still alive. He's back to work. He's still getting a little treatment here and there.
Right.
And he's paying his taxes. Or there's so many stories, you cannot stop. And that's why as an oncologist you have to be humble. And I really discourage doctors from telling these poor patients we've got 6 months to live, a year to live. Life is not in my hands. Whatever nature or God brings people, it will bring people. My job here is not to give people what one of my patients called expiration dates. Mm-hmm. Our job is not to give expiration dates. Our job is to give hope, to do our diligence. That when that patient dies, every stone is turned and nobody has any regrets. Nobody picks having cancer, but people can pick their treatments and the type and level of care they get. And I hope no family should look back and regret how their family was not treated, that the family should have been treated better. That really hurts. That's what happened to my dad. He should have been treated better at the time.
You were meant to do this. You were meant to be not just an oncologist, but a place of comfort for so many people, because not all doctors are like that. Doctors are people, they have different personalities, but I know that compassion is a huge part of trying to get over anything, any challenge, because you're vulnerable, you're ill, you're weak, and when you have a doctor like yourself leading the way, it gives not only hope, but it's very inspiring. It's beyond inspiring to me, and I wish that everybody could have a doctor just like you.
I'm sure there are better doctors out there. I hope whoever is the doctor for any of these ill people looks at their patients as their family. Yeah. That's all you can ask for. Listen, go to somebody who really cares for you just like their own sister. Not as a business, not as a corporation, not as... think of your patient as your family. Give them the proper referrals. Cut the red tapes. Send your patients to a surgeon that you would send your mother to, not right. Just because you have a business relationship with. Or send your patient to a hospital that you really would want to go yourself. Wow. And if you do that, I think we're all going to be blessed.
Absolutely. Well, I want to thank you. You are a blessing.
Thank you for your time, for being here. And I hope the message gets out there that it's all about caring. It's all about spirit of hope. It's just keeping people dancing with the cancers and not fighting constant. And even though my patient died, she went dancing. She didn't go fighting. And the quality of life was fine.
It's an honor.
My pleasure. Thank you. Thank you so much for being here.
Thank you.